Thank you, Minister, and good morning. So thanks to the quick and terrific work of our public health team, we're forming a detailed picture of the movements of both of our Sandringham cases that are reasonably limited, which is good news. They are both being supported in hotel quarantine. Our public health services have been on site at the housing complex in Oakleigh since Wednesday evening to make sure the residents have stayed isolated and got tested as quickly as possible, because the speed of response in these moments is really critical. How quickly we get the public health team onto the ground and how quickly people come forward, get tested, isolate, makes the difference between having potentially infectious people isolated, quarantined for their entire infectious period, or potential widespread community infection. Pleasingly, all 49 tests that have been done so far at the Oakleigh site have returned negative results. The residents will continue to be offered testing over the next week or two. The testing process for 134 primary close contacts from the Jetstar flight is well underway, and 49 tests have already come in for that group. Our team has also analysed the QR code data and other records from the dry cleaner, with 56 primary close contacts identified. There are also 36 close contacts from the trips on the bus and train network late from last Sunday evening. And getting your Myki registered, as this case did, helps us contact you if you were on some of those trips, or indeed any other trip. If any other exposure sites are identified linked to this case, they'll be put on the department's exposure site webpage. There are certainly more people out there who visited exposure sites. We have set up additional testing sites in the local area, so please check the website around those exposures and go and get tested if they apply to you. These are the first few critical days and we absolutely need your help to get on top of this. Victorians have heard the message about testing. We've had another strong day yesterday with over 20,000 results in. Our public health team's doing a terrific job making the test sites available, and waiting times are really minimal, and test results turned around very quickly, more than 95% within 24 hours. And as we know from the positive cases in Sandringham, many people know of their results on the same day, which makes a difference again in the response. Your decision to test is our first line of defence against the spread of the virus. It's how we learn about any new case, how we protect the community from the risk of infection. There has been a wastewater detection to the north of Melbourne in the Lower Plenty catchment from samples that were analysed between the 22nd of June and the 24th of June. The suburbs with the detection area include, and there's a long list, Briar Hill, Bundoora, Diamond Creek, Greensborough, Lower Plenty, Macleod, Mill Park, Montmorency, Plenty, South Morang, St Helena, or Helena perhaps, Viewbank, Watsonia, Watsonia North, Yallambee and Yarrambat. My understanding of that is it's a large swathe to the north and east of Epping area largely. This could be a historical case continuing to shed virus, but we are asking anyone who lives in or who has visited these suburbs to please watch out for the slightest of symptoms and come forward and get tested at one of the many local testing sites. Our message to anyone in the area with the slightest of symptoms, just go and get tested. We also achieved a really wonderful milestone of 1 million doses delivered at our state-run mass vaccination hubs. That's a terrific number. And then in total, more than 2 million Victorians with at least one vaccine dose across all of the vaccination modes. There's still a long way to go. My key message, you've heard it this week, please get your second dose after your first dose. whether it's Pfizer, whether it's AstraZeneca. If it's due now, if you can book in now for that second dose, please go and do so. It'll be the really substantial protection that we need to protect ourselves from outbreaks, from transmission going forward. We still have room for more second dose appointments in our system, and AstraZeneca walk-ups are still available at many locations around Victoria. Your decision to get vaccinated is our path out of this pandemic. So please bear that in mind and get tested if required. Check in everywhere you go, every time, and stay safe. Thank you.
How infectious this Delta variant is, are you expecting to see more positive cases come from those 2 Sandringham cases?
Not necessarily. You know, this is a virus that does random things. You can have one very infectious person who transmits to many others, or actually the majority who transmit to no one else at all. The cases both wore masks. Obviously, they were in close proximity within a closed space for hours on end, and there's been transmission between them. But the second case in Sandringham hasn't transmitted to his family that we know of. They've tested negative initially, and you know, it may be that they're simply not as infectious as others might be. But we have to find everyone who's a primary close contact. Obviously, they have to quarantine. So there's a possibility, but we're, as I say, working really hard to identify those people as soon as possible and make sure that they're in a quarantine position should they turn positive.
Reports today that 2/3 of aged care staff remain unvaccinated. How concerning is that for families with a relative in aged care right now?
Look, it remains a really key area to work on. We need all aged care workers to receive both of their vaccines. That needs to be an absolute push. As you know, it's a Commonwealth responsibility for private sector aged care. But it's everyone's issue, and we all need to work extremely hard together to both for the message for all of those workers to come forward and get the vaccine, in particular because of that really important charge that they have of looking after the most vulnerable populations in Australia.
Why do you think that's the case, that still so many remain unvaccinated in
Look,
aged care?
it's hard to know exactly what the barriers might be. Of course, some might have concerns about the vaccine. We need to address that individually and collectively with the entire sector. There may be issues around rostering and the time to get that vaccine, or the availability of sites nearby. Whatever those obstacles are, we need to address each and every one of them and make sure it's the easiest, most accessible and, an action that everyone is motivated to do, with an understanding of that really important responsibility they have to look after people in aged care. Residents are getting vaccinated at high rates. That's reassuring, but outbreaks have still occurred in aged care settings with high vaccination rates, and everyone should reflect on the fact that 1 in 3 individuals in aged care, residents, who get infection die. 1 in 3. It's an extraordinary figure. They are extremely vulnerable if they're unvaccinated. We've had residents infected through the Arcare Maidstone outbreak. They had mild illness or asymptomatic illness because they were vaccinated. It's more or less around 1% or less risk of dying if you're a vaccinated resident in aged care. So, it makes a crucial difference to be vaccinated as a resident, and of course as a worker, you want to do your absolute utmost to ensure that those residents aren't exposed unnecessarily to a virus or to an outbreak in those settings.
Is your sense, Professor, that there's a good proportion of people who've been to the exposure sites who are coming forward at the moment, particularly the dry cleaners and also the Oakley apartment complex? What kind of building is that, and what's the nature of it? And is the whole complex in lockdown now?
So to the second point, it's a low-rise building. There are not really common areas of concern. There is a car park access, but it's effectively like an outdoor setting. It's very well ventilated. It's an open area, so no expectation that there'll be transmission there. There isn't a lockdown for the building. There is going to be ongoing testing support for anyone who needs it over the next couple of weeks. In terms of people coming forward from exposure sites, we've got reasonable numbers. You never know exactly how many might have been to some of those sites, but they're coming through the system now, and we'll reconcile them against our negative test results.
On the dry cleaners, I think you said 49 negative tests so far?
No, it was 49 primary close contacts for the flight and 49 for the Oakley setting. For the dry cleaners, they're coming through today. We don't have the full numbers negative yet.
Have you got some negative tests back from dry cleaner
There
customers?
will be some that have come through, yes.
Yeah.
We've identified, I think I said 54 primary close contacts for that setting.
Is that a good indicator?
56.
56. If there are negative tests coming through from dry cleaner customers, is that a good indicator that these guys were not highly infectious and that there was not particles in the building?
Yeah, it will be a good sign. Again, it's great to get a significant number of tests back. You don't want to miss anyone. So there's always that one individual who might have had transmission to them. So we want 100% coverage for everyone who might have been there at that time. But as those negative tests roll in, of course, it'll be more reassuring as time goes by.
At what stage were they in their infectious period? I think Paul just touched on it there, but how far along? Can you give us a snapshot with the dry cleaner?
Oh, it was really early days. It was, the concern is that the most significant infectious period is just before developing symptoms, and so that applied to both of them being at work for part of that time. So, we just have to work on the basis that there's potential transmission there and find everyone.
In terms of the border with New South Wales, what are some of the trigger points that you might look at as to whether to upgrade or change the sort of nature of those restrictions?
Look, at the moment, it's a very strong border response, as the Minister has outlined. The highly visible, highly mobile patrols that Victoria Police are undertaking is probably, a stronger response than we've had even with the fixed sites previously, because there are no feeder roads that are potentially not covered by those mobile patrols. So everyone has a chance of being found out if they're trying to get around those controls. So it's a really robust response. But in terms of my level of concern, it would be, if there are wastewater detections or known cases or known exposure sites that are much closer to the border in southern New South Wales or other regional areas of New South Wales.
New South Wales is currently locking down local government areas. We tried that and it didn't work last year. What would be your advice, or what can they learn from our mistakes perhaps?
Look, I can't speak to what their specific decision making is and why it might be their approach in Sydney. I do know that we had significant challenges in Melbourne. There are issues of needing to control people who want to move out of those areas to other areas where freedoms are greater. There's the issue of being able to manage people who want to move out of those areas or who need to move out of those areas for essential work purposes, and all of the compliance and enforcement that needs to apply to that. So there are significant challenges in having a pretty localised response, but New South Wales will be well aware of that. They were well publicised through Victoria's second wave.
In terms of you saying that vaccines are the pathway out of here, what's the current thinking about vaccinating children, and what's the checks on the vaccine effects on children and so on? What's your view on what's happening in that space at the moment?
Certainly there are vaccines under development that will go through a testing process for registration within those countries where the vaccine's being produced and tested. At the moment, there are some countries that have given approval for Pfizer, for example, for children 12 and over. That needs to go through the same process in Australia with the Therapeutic Goods Administration. But if they approve of a different age cohort for Pfizer vaccine, or indeed any of the other vaccines, that will be a welcome development. But I wouldn't get ahead of us in terms of the TGA's decision making. They've got very stringent and a high bar for safety and efficacy for those vaccines. But if it is available and registered in Australia, and it brings in a cohort of children of whatever age it's approved for, that's another proportion of protected Australians. It makes it easier to get to a herd immunity level, and it obviously addresses an age group that can be a driver of transmission potentially.
And when do you think effective herd immunity might be gained in Victoria based on current pace the children being vaccinated, everything that we've just talked about?
There are so many unknowns in that space,
Sure.
obviously, with regard to whether children have a vaccine available for them, what new variants of concern might emerge, and really the vaccination uptake. It's a challenging level to get to, but I think we need to absolutely aim for it. Because it is the difference between battling these individual outbreaks and clusters, or indeed having very substantial transmission, versus being able to live our lives as we would wish to have.
Has there been any more inquiry about how New South Wales Health didn't contact the father of the Sydney super spreading event?
Look, effectively, all I understand is that his name wasn't given as a primary close contact for that party for whatever reason. So that wasn't
daughter.
with New South Wales Health to follow up, and it wasn't captured in the list.
So it wasn't given by the daughter as a name?
Look, I'm not going to go into details about exactly what
whoever
happened, but
provided the list.
it wasn't made available to New South Wales Health for them to chase him up individually.
Was there discussion yesterday at AHPPC about New South Wales's approach? managing this outbreak?
Committee in confidence as per normal, but we have conversations every day around updates on all of our cases across the country.
We received reports yesterday that a number of people who were booked in to get their first dose of the Pfizer vaccine were turned away from Jeff's Shed. They were told that there was a shortage of the Pfizer vaccine despite having appointments. Is that something the department was made aware of?
I'm personally not aware of it, but there's an entire arm of the public health response responsible for vaccination. I can look into that and get back to you.
Minister, if we could.